Okay, I see that it's recording. Good morning, everybody. My name is Ram Sharma. I'm one of the inpatient psychiatrists at Krishna Care. I primarily work at Wilmington Hospital, taking care of patients who are admitted for their acute needs regarding their mental health. And I have a particular interest in circadian rhythm. Just a little background. Before I moved here, I was at NYU. I was doing research in sleep and Alzheimer's. And during my residency, I developed this interest in looking at circadian rhythm and psychiatric illness. I'm planning to do a few research projects, hopefully funded by different agencies on circadian rhythm and different mental health issues. But here I will be just talking about circadian rhythm just because it's a newer topic and kind of like explain why it's important and how it kind of just not affects mental health, but all of our different bodily functions, physiological functions. So I'll begin with the first slide. Okay, so first, what is circadian rhythm? So it's basically a natural cycle of physical, mental, behavior changes that body goes through in a 24-hour cycle. They are mostly affected by light and darkness, as most of us know, and are controlled by suprachiasmatic nucleus in the brain. And basically, light is the switch on and switch off signal for triggering melatonin, which orchestrates the rhythm. Um, they can affect not just sleep, it can affect body temperature, hormones, especially like cortisol. It can affect our appetite and many different body functions. When it comes to illnesses, it's associated with obesity, diabetes, of course, mental health issues such as depression, bipolar disorder, seasonal affective disorder, uh, and definitely sleep issues like insomnia. It's sometimes called as body's clock, um, and decides like how we run our body on a day-to-day basis. There are many different kind of rhythms in the body. I'm focusing on the circadian, which is a 24-hour. There's diurnal rhythms, which cortisol follows. There's ultradian, which is like usually less than 24 hours, which are faster rhythms. And then there's infradian or lunar or circulunar, which is like, especially in women, like it's monthly menstrual cycle that goes through. And then there's circannual. There's very little circannual rhythms in the body. They haven't found any known yet. This is what a circadian rhythm, when you fit it on a day-to-day basis, looks like. It fits a cos sine mathematical model. So basically, it's like a wave. And if you guys can see my pointer, the up phase is mostly the activity, and where it says the acro phase, that's the time of the day when somebody is most active. It's different for everybody. For most people, it falls between 12 to 3 p.m. But in certain illnesses, in certain medical issues, it can change. Uh, the other important part is the amplitude, like how much is active. And that's very important because a lot of psychiatric illnesses, the amplitude goes down, especially depression, seasonal affective disorder. There are different changes in bipolar disorder, but I'll talk about that a little later. So these are different changes that we see in many different illnesses. So A is the normal one that I just explained what amplitude is, what acrophase is, and the period is like from peak to peak, like how long a circadian rhythm is for an individual. B is, I just heard somebody talking about traveling. B is what we see in delayed phase, where this whole rhythm gets delayed. And often people see that in jet lag because they travel, like if somebody is going to um, more than a 6 hour flight, like Europe or for me, India. And then it just confuses our mind and our body takes a little bit of time to get adjusted to the normal rhythm. Most of us do it fairly easily. Some of us have a hard time adjusting to it. C is the red one represents the depression where the amplitude goes down and people are not as active. They're physically not doing much. They feel low, down. And we do see that their amplitude of circadian rhythm also goes down. D is what represents a bipolar disorder where they're not sleeping too much and they're having a faster rhythm. And E basically is showing aging, but in a condensed fashion. So consider this like even more than a decade, maybe 15 to 20 years. As we grow old, our circadian rhythm goes down normally. And we know this from many different studies out there. So this is again just showing importance and some of the complex nature of circadian rhythms. It's controlled by not just light. There's a lot of genetic factors that plays role. There's a lot of different kind of neurotransmitters that plays role. But I'll just bring your attention here. So this is homeostatic pressure, which also seems to play a role in our circadian rhythm. So light is the primary driver, but if we are not tired enough, we don't fall asleep. If we don't fall asleep, our circadian rhythm goes off a little bit. But I just want to highlight sleep is the not the only factor that's part of circadian. So it's a combination of activity and sleep. This diagram is a little more detailed. I'm not going to go in so much detail, but I just wanted to show you guys how sleep also contributes to kind of making sure that our circadian rhythm is doing well. Again, a lot of illnesses are part of circadian issues. The primary circadian dysfunction is delayed phase disorder, which we experience in jet lag. A lot of insomnia patients have that. More recent studies have been showing that it's not basically a disorder if it's normal for you and there's not a change. Some people are late sleepers or night owls, and that's fine if it works for them. Um, the other thing that circadian has been really looked into it is Alzheimer's disease because we know sundowning, when it's evening time, patients with Alzheimer's get more agitated, and they are finding more and more evidence to show that it's actually part of the circadian issue rather than anything else. Um, I talked about delayed sleep phase syndrome. It's sometimes people go to sleep like early morning instead of like late night, and it's just normal for them. And sleep medicine have kind of accepted that as a fact. The other part that I really want to brought up is a lot of illnesses, medical issues are associated with circadian rhythm. For example, heart attacks are most commonly found to happen like early in the morning. Um, Also, the heart attacks that happen early in the morning, they have seen in the bigger studies that they are larger in size and more severe. Energy metabolism is again tightly linked. If circadian diabetes is kind of at high risk, like people are at high risk of developing diabetes, it increases the insulin resistance if there is not good circadian rhythm. And then there's been growing evidence of showing that natural aging and alteration in circadian rhythm is known. But if it's too much off and it's a sudden off, then it can worsen dementia-like picture. Um, I'm not going to go much detail, but there are ways we can address the circadian rhythm issues. But first thing would be to identify that insomnia is because of some circadian rhythm problem rather than just like sleep issues or wake problems. Um, so there are a few things we have to look circadian rhythm two different ways: things that trigger our sleep and things that wake us up. So melatonin and orexin. There are different ways people are trying to come up with solutions, not just medication. CBTI is one of the big ones. Um, that there are like orexin receptor antagonists, which are newer but have a lot of promise in how they work. Um, just to conclude, like the goal of this presentation from my end was to just explain what circadian rhythm is in a short period of time, and also how um, it's just not mental health that it affects, but many different illnesses that humans suffer from. The last thing that I want to just discuss or say is newer medications, they're trying to also time them according to the circadian rhythm. So there's studies out there and they're trying to figure how to take even antihypertensive medication. And they're trying to show that if you take it at nighttime, you have better efficacy of those medications because people who have essential hypertension, their blood pressure don't go down when they're sleeping. Most people's blood pressure go down when they're sleeping, their heart rate go down. But people who have essential hypertension, it kind of like sticks throughout the night at a good level, which is not good for most people. And so they're trying to even find out if there can be timings of medication that can assist in better outcomes. So that was my presentation. I think that's closer to 10 minutes. So I'll stop there. I'm, happy to answer any questions, or if you guys want to know more about circadian rhythm, I will be more than happy to like share more in detail. Um, yeah, but that's it. Thank you.